Hi there, ladies and gentlemen. Welcome into CTV Beam. I'm Edgar Champagne. You're on the road to wellness with Dr. Stanley Himes. Dr. Himes, we've covered a lot of information. We were talking about stress last week and everything, but alcohol is what some people elect to use to relieve stress. Is that a good idea?
No, not really. But let's talk about the basis of alcohol. So alcohol or ethanol is a substance that makes you drunk. Mm-hmm. So it's produced by yeast from grapes or grains in manner of beer. And it has a powerful effect on your mental state. So it can reduce your self-consciousness and shyness so that some people act without inhibition. So that can be dangerous, particularly. At the same time, it can impair your judgment and promote behavior that may end up being very regretting. Mm-hmm. So, particularly with college kids, there's been an increase in what's called binge drinking. That's drinking multiple drinks. I think that's drinking more than 4 drinks within 2 hours. And so there's been a very high rate of people who have died from alcohol intoxication. So let's talk about some of the health benefits and negatives of alcohol. So what is your liver's role? So your liver's main role is to neutralize any toxic substances that come in the body, of which alcohol is considered a toxic substance. For this reason, the liver is especially vulnerable to alcohol. So the first thing to appear with too much alcohol is what's called a fatty liver. The cells in the liver get fat in them, increase fat inside of them. Fatty liver develops in 90% of people who drink more than a half an ounce, which is 15 milliliters of alcohol per day. Now that is reversible, that change in the liver. We cannot live without our livers. You can't live without your liver. You can't live without your kidneys. Yeah. Now, we do have a way to, if your kidneys fail, for dialysis. That's not true of the liver. So if your liver fails, for instance, if someone goes out and they eat a toxic mushroom, the liver is trying to detoxify that before it gets to the body, and then it kills the cells in the liver. The liver is the only organ in the body that can regenerate. Interesting enough.
Wow.
So the second is if you're drinking too much alcohol on a regular basis, the liver can become inflamed and the cells within the liver die and they become fibrous. It's scar tissue. And that's called cirrhosis of the liver. And cirrhosis of the liver is irreversible. So people who have been longtime alcoholics and heavy alcohol intake, a lot of times they will get cirrhosis of the liver. And the liver is involved in your clotting factors, it's involved in detoxifications, it's involved in protein synthesis. So many things that the liver is involved in. So that's the effect of alcohol on the liver, excess alcohol.
Yeah. Well, what is the effects of alcohol on the brain?
So basically, alcohol reduces the communication between brain cells. And that's kind of the feeling of being drunk. Now, I have never been drunk, so I don't know.
Yeah.
I've never gotten to that point. Now, when I was in college, I got to watch people when I was a freshman in the dorm. These people were drinking beer to the point of getting drunk. So I just observed them. It was very interesting. But, you know, what happens is when people get so inebriated, they can throw up. And if you throw up and you're so obtunded and so sleepy, you can't protect your airway. Normally, when you swallow, the body is set up so that you cannot swallow and breathe at the same time because it's like a toilet seat. It clops shut. That's what's called the gag reflex. So if you get something on your vocal cords, you start coughing and body won't have any of it. So your airway is always protected to keep things from going down the airway and you getting a pneumonia. Mm-hmm. So if you drink so much that you're so uptunded, that you're so drunk that you're passed out, and you throw up, you can aspirate that and get a pneumonia and die. Mm. So that's very bad. So people who are chronic alcoholics and drink too much alcohol over a period of time can get dementia and have all kind of brain problems. And in middle and older adults, the brain can actually shrink.
Really?
Shrink, okay?
I didn't know that.
That's not good.
Wow.
Actually shrink. So as you get older, you have to be very careful on the amount of alcohol that you drink. And we're going to talk in the next segment about what is a standard drink, what that means. Women cannot drink as much as men because women's livers are smaller than men. That is the main reason.
But you said that the liver can kind of repair itself unless it goes to that
To a point.
to that severe stage.
Yeah, it can repair itself to a point. So these college students that are doing this binge drinking, that's not good because you can get hepatitis, you can get inflammation of the liver cells, so that it's not reversible.
Okay, but a half an ounce, that's not very much.
Half an ounce, 15
That's like
mLs.
A shot is an ounce.
No, we'll get to that.
Oh,
We'll
gee,
get to
first.
that.
All right, we're talking with Dr. Stanley Himes on the road to wellness, and our subject today is alcohol and the effects on the body and the brain and all the organs. Stay with us. We will come right back.
We're going to talk about one more thing here, body weight.
Body weight.
Now, people who drink a lot of alcohol can put on a lot of excess weight because alcohol has a high caloric amount. Alcohol is the second most calorie-rich nutrient after fat.
Whoa.
So there's 7 calories per gram of alcohol. Alcohol has a lot of calories in it. Now, moderate and light drinking is linked to reduced weight gain, whereas heavy drinking is linked to increased weight gain. So remember, alcohol has a lot of calories and very little nutrition.
Okay.
A lot of calories and very little nutrition. So a lot of times when we would get admissions for someone who's chronic alcohol and they're in withdrawal, they were nutrient deficient because they had been drinking alcohol and hadn't been eating. So they're getting their calories but no nutrition. So you'd have to give them certain medicines intravenously so they wouldn't go into delirium tremens and all of that.
Wow.
But that's another story.
Stay with us. You're going to want to hear these next topics. We're going to talk about heart health, cancer, diabetes, risk of death with alcohol. On the road to wellness with Dr. Stanley Himes, I'm Edgar Champagne on CTV Beam. We'll be right back.
Well, Thomas, you've got prediabetes. But with more exercise and a change in diet, it can be reversed.
I've tried exercising. It just makes me hungry for bacon.
I love bacon, too. And who really likes to exercise?
Not me.
Me neither.
Nobody. So we're good?
What? Oh, you still have prediabetes. Big time.
Welcome back to the road to wellness with Dr. Stanley Himes. I'm Edgar Champagne, and our subject today is alcohol. Dr. Himes, we wanted to talk about, did you want to talk about the measurements that we mentioned a while ago?
Right. 15 mLs, that's not half an ounce. So actually, one drink, we're going to talk about that later, that's 1.5 ounces shot glass of distilled spirits, 40% alcohol. So that wasn't quite right.
Well, heart health and alcohol, how does that work? How does that?
So light to moderate drinking, that is 1 drink per day for a woman, 2 drinks for a man, is linked to reduced risk of heart disease. That's called light drinking. Heavy drinking increases the risk of heart disease. So you see there's a balance there. And red wine has been shown to be more heart healthy than other types of wine because of the resveratrol in the red skins of the red grape.
Sure. Okay, good. How about type 2 diabetes? Does alcohol affect that or increase
So
it,
light or
decrease it?
moderate drinking appears to reduce, strangely, interesting enough, insulin resistance. We talked about insulin resistance with diabetes and how important that is. So light to moderate drinking reduces insulin resistance, so the insulin works better. So as a result, drinking alcohol with meals may cut the rise in glucose you get from eating the meal 16 to 37% more than water. Very interesting. So blood sugar between meals, fasting blood sugar may also decrease with that alcohol with the meal. So, but we're talking about light to moderate drinking. We're going to talk about that later, what that means. Now, cancer, interesting enough, alcohol consumption increases the risk of cancers of the mouth, throat, colon, breast, and liver. So, you know, obviously the liver, that makes sense because the liver detoxifies everything. But people who drink alcohol have an increased risk of breast cancer and colon cancer. Now, even light drinking of 1 drink per day is linked to a 20% increased risk of mouth and throat cancer.
You're kidding.
Even light drinking. So, very interesting enough.
Gee, Bert.
So a lot of times people who are diagnosed with breast cancer or colon cancer are told to stop drinking alcohol.
Mike Douglas, the real popular actor, was on one of the talk shows. In fact, I saw him on 2 talk shows, and he was saying that his doctors were telling him that sugar was his main cause for the cancer because he wasn't drinking very much, but just 1 drink a day can increase the likelihood of developing cancer.
Mouth and throat cancer. Now, I think he had throat cancer.
Throat cancer.
Now, I'm not sure if he was a smoker in the past.
I see.
I bet you he was a smoker.
Okay. The risk of death.
Studies suggest that light or moderate consumption of alcohol cuts your risk of premature death. So people tend to live longer and not die early. Now, the bad side of alcohol is the danger of addiction. Now, there's a certain percentage of people who cannot drink alcohol. They become addicted to it. They become what's called alcoholics. They cannot drink alcohol. So that takes a heavy toll on people, alcoholism. Now, pregnant women are told that they cannot drink alcohol because alcohol, we know, can cause birth defects, particularly in the first trimester when all the organs are being formed. Yeah. So drinking early in pregnancy you're told not to do that at all.
Would you say it's best to not drink at all during that 9 months? Or
Yes.
Yeah, really?
Yes.
Okay. I mean, when a woman is over around 7 or 8 months and everything, a glass of wine
It's
at
probably
a major,
all right.
major celebration?
Yeah, it's probably all right.
Probably all right.
Yeah, not the first trimester, the first 13 and a half weeks. No, absolutely not.
How
No
much is
alcohol.
too much, Dr. Hines?
So we're going to talk about what is a standard drink. 1 drink. 12 ounces of beer, that's a can of beer, that's about 5% alcohol. 8 to 9 ounces of malt liquor, that's about 7% alcohol. 5 ounces of wine, and that's about 12% alcohol. Or 1.5 fluid ounces of distilled spirits, gin, rum, tequila, vodka, whiskey, etc. 1.5 ounces. So that is 1 drink. That's not very much. Now, of course, in a mixed drink, they don't put that much. They put a little bit, small amount of alcohol, which is how they're making their money.
Yeah.
But a problem with a mixed drink is that it has a lot of juice and a lot of other stuff, high calorie, high sugar. Plus you're drinking the alcohol. And I think that sugar is deleterious can be deleterious to your health.
My friends take the bottle and drink 3 or 4 swallows and then pour a little bit in the glass and then kind of sip it.
Too much. So, for instance, a glass of wine, a bottle of wine,
Yeah.
there are 4 glasses.
4 servings, yes.
There are 4 servings in a bottle of wine.
Yes, sir.
So, I like to drink 1 glass of wine a day. Now, they said that a standard drink that a man can have is 2, but I believe that 1 is enough.
It's enough.
So I believe for a woman, that's half of that. So if I'm drinking 5 ounces of wine, then a woman should probably drink half of a glass of wine.
Yeah, 2.5.
Right.
Okay.
Particularly as you get older, because it has a more harmful effect on the brain and all of that.
And revisit the part about the red part of wine. I mean, is more healthier, whatever.
In the red wine grape, it has what's called resveratrol. And we know that resveratrol in studies is very good for the heart. So in Europe, in Italy and France, they drink a lot of wine, and particularly red wine. And the studies have shown that they have improved heart health with drinking that 1 glass of wine a day,
Yeah.
or 2 glasses for a man.
Pretty interesting.
So that's on the alcohol. Okay. So standard 1 glass is 1 mixed drink, 1.5 of shot.
Run down that list again over there, because there's a lot of people going to be disappointed when they hear this. How about
1 beer
1 beer
is 1 drink, one beer. Now they have these light beers that are supposedly lower in calorie. They're not that much lower. It's the difference between 130 calories versus 90. It's not making that much difference. It's still, and in the light beer, and even in the beers that are low alcohol beers, there's still a significant amount of alcohol in there. So you're kind of fooling yourself. So if you either drink or you don't drink, otherwise. So 1 5-ounce glass of wine is a drink. Okay.
When we go to golf tournaments, they have beer unlimited. It's like a fountain. It never stops.
Yeah, that's a problem.
It's a problem for me because my ball's in the woods. But
that's a problem. And people who drink so much that they're drunk and they're hungover.
Oh yeah, I don't get that.
That's a problem. That's not good.
No, that's not.
That's
good at
not
all.
good.
That's not good at all.
So that's very bad for your health.
But and then what was the other about the real strong liquor like
The
bourbons?
distilled
and gin?
spirits,
Yeah.
1.5 ounces. How much is a shot glass? Is that about
That's
1.5
an ounce.
ounces?
A shot's an ounce. So you
Okay.
a shot and a half
Shot and a half. That's it.
for a grown man.
For a grown man.
We look at the soap operas, Dr. Himes, and they got at least
Well, that's fake drinks there.
that's tea probably.
That's green tea probably.
Yeah.
So alcohol has good, it has bad, and it has ugly. And the ugly is the addiction and chronic alcoholism. So we have people who have drank alcohol and been alcoholics and have damaged the liver so much that they have cirrhosis, and there's bad side effects from that. They have bleeding veins in their esophagus because their liver is so fibrosed and messed up that the blood backs up. They get ascites, they get the big belly with the fluid. Terrible. So I think it's fine to drink in moderation. 1 drink, I say, a day for a man, half for a woman. We told you what those drinks are. Yeah. So in the next segment, we're going to talk about some hot medical issues that are in the news.
Hot topics.
Yeah, well, not hot topics, but hot medical issues.
Hot medical issues.
Yes, that are in the news. And we're going to talk about aspirin, and we're going to talk about sleeping pills.
Okay, good. You're on the road to wellness with Dr. Stanley Himes. My name is Edgar Champagne. Thank you for tuning in to CTV Beam. We will be right back. Don't go away.
Body language. Without saying a word, it can tell you so much. Like someone is having a stroke. Know the sudden signs. Learn fast. F, face drooping. A, arm weakness. S, speech difficulty. T, time. Time to call 911 immediately. The sooner they get to the hospital, the sooner they'll get treatment. And that can make a remarkable difference in their recovery. Learn the body language, the sudden signs, and spot a stroke fast.
Welcome back to the Road to Wellness. You're on that road with Dr. Stanley Himes. There's no other road to drive other than the road to wellness. My name's Edgar Champagne. Hot medical topics. That's what we teased about before we went to break, Dr. Himes. What are some of them?
So we're going to talk about, in the news here recently, they're talking about aspirin. Risk, benefits, and people shouldn't be just taking aspirin as before. And this has been an issue for me for a long time. I would have people come into my practice and they'd be on aspirin. I said, well, why are you taking aspirin? They said, well, my doctor told me to take it. And I said, but why? And they didn't know. So a lot of people felt that a baby aspirin, which is usually 81 milligrams, improved someone's heart risk that's had a heart attack. But there were never really any studies to prove it. So a lot of people who had had either a embolic stroke or a heart attack were put on aspirin, or who had a high chance of having these things were put on aspirin. So then a lot of people started taking aspirin. Now aspirin's over the counter. You can buy it from your local pharmacy. They're just taking an aspirin a day. That's very dangerous. So what the study showed that, particularly in people 60 and over, the risk outweighs the benefit unless you've had a prior heart attack or stroke, embolic stroke. The risk of bleeding in your stomach from an ulcer, or bleeding inside your skull, an intracranial hemorrhage. Now, I had a relative who I believe was unfortunately taking a baby aspirin and didn't need to be taking it. She ended up with an intracranial hemorrhage. And that's a bad stroke because there's really nothing you can do about it. An embolic stroke, where a clot goes and blocks the vessel, you can go in and try and break it up and give declotting. But a hemorrhage inside the skull is bad. So they found out that people that were taking these baby aspirin were bleeding in their brain and dying. So the FDA came out, told doctors, you've got to stop giving aspirin prophylactically. The only people that should be getting it, the only people they saw an improvement in were people 50 to 59 who had had a previous heart attack or an embolic stroke, or who have a high risk of having those, i.e. they're diabetic, high blood pressure that's not well controlled, elevated cholesterol and bad cholesterol. Those people have a high risk of having a heart attack. They should be taking it. But once you get to be 60, there should be very few people that are taking it.
Well, for the people who are watching out there that like Advil and ibuprofen and all that, what about those?
No.
No?
No. Those are called non-steroidal anti-inflammatory drugs. And what people don't realize is they have some of the same bad effects of aspirin and more. So they advertise these things, ibuprofen, naproxen, indocin, and people are taking this stuff like water. And I am here to say that I was taking Motrin because I had problems with my back. I was playing tennis and my back would start hurting. I was taking these Motrin, and now I got an ulcer. You're supposed to eat it with food. I was eating it with food. I still got it. I got a bleeding ulcer from that, from taking that. Now, people know that, but they don't know about the heart effects. These have bad heart effects, these non-steroidals. So if you're going to take them, you take them briefly, and you don't take them on a chronic basis at all. The non-steroidal anti-inflammatories.
Jeepers. All right, so we're going to move on now to another topic. We're going to talk about prescription drugs.
We're going to talk about sleep warnings on the Z drugs, they call them.
Oh.
So we talked about sleep before and prescription. So there are a number of people that are on prescription drugs. And these drugs are Lunesta, Sonata, you're going to see pictures on the screen, and Ambien. Okay, those are the Z drugs. And the FDA news release, the black box warning, that's the highest warning that they give.
Right.
On the label of prescription to alert consumers and healthcare providers of a safety concern, such as a life-threatening risk. It said that these people on these drugs can have very significant sleepwalking events and adverse effects. So people were engaging in activities and not fully awake. So I briefly talked about this when we were talking about sleep, that people will be sleepwalking. Normally in sleep, when you're in REM sleep, you can't do anything because basically your muscles are paralyzed and the body has a way so that you can't act out the dream. So just think you're in a dream and you're acting it out and you are still asleep and you're walking. People have been known to drive a car. They've been known to get into the refrigerator and eat and get up in the morning and the refrigerator's empty. I mean, bizarre. So it's terrible. So there have been 2/3 of these have been non-fatal, a third have been fatal. Falls causing fractures, hip fractures, knee fractures, arm fractures, loss of limb, injuries due to exposure to cold. You have people go out in the winter into the snow and be outside and get hypothermia.
Frostbite now.
Yeah, frostbite. You've had people pick up a gun and shoot themselves because they're acting stuff out most likely in the dream. You've had fatal injuries, carbon monoxide poisoning, hypothermia, motor vehicle collisions, other causes. So there have been very celebrated cases where people say, well, I was taking Ambien and they were driving, they ran into a tree. So finally, I've known about this for like 15 years. Now this is just coming out, and physicians have known about this for at least 10 years. So you've got to really, the other thing about these drugs is that they're habit forming. So these are never meant for you to take long term. And what they've done is they've told the doctors to reduce the dose on people over 60 because the people over 60 have been extremely prone to having cognitive problems thinking, and having the sleepwalking, and having, like, they're hungover. So they tell people if you take these medicines now, you should not drive to work the next day, period. Because there have been too many car accidents, too many fatalities, too many things happening.
Even if the person's getting 8 or 9 hours of sleep?
Even if they're getting 8 or 9 hours. That's what they said before. Now they're finding that people are still hungover. They still are not what they should be after 8 or 9 hours of taking these medicines. So I have a list of, so these drugs are taking the place of some other, what I call sedative hypnotics, which are benzodiazepines. That's Valium, Librium, Xanax, because these were habit forming and caused disruptions in the sleep. These people sleep, but they really don't have restorative sleep. Plus you have these side effects, plus you become addicted to them. So some of the, some of the high prescriptions,
Vicodin?
the top 10 prescriptions. Number 1 is Vicodin.
I knew
Okay,
about
so
that.
that's an opioid. We've got an opioid crisis. Number 2 is Zocor, simvastatin. That's a statin drug. 3, lisinopril,
Yeah.
generic for Zestro or Prinvil. Synthroid, which is levothyroxine. Zithromax, you've heard of a Z-Pak, antibiotics. People are getting far too many antibiotics. That's another story.
The Z-Pak is during colds in the wintertime, though, right?
Yes, but most colds are caused by viruses, and these are antibacterial, so that's worthless.
Oh,
All they do is make strains become more resistant, and we have problems. Metformin is number 6, Lipitor is number 7, amlodipine, which is the same thing as Norvasc. Number 9 is amoxicillin, and 10 is hydrochlorothiazide. So a lot of these medicines are being prescribed, and a lot of these sleeping pills are being prescribed for people. So people really need to be careful. There's other things to do for sleep, and we talked about that, good sleep hygiene and other things to get to sleep rather than get hooked on these prescription drugs.
well, give us a tease of what we got coming up down the road. What are some things we're going to be talking about?
Well, I'm not quite sure, but maybe we'll be talking about diabetes and insulin resistance and how diabetes works, and those subjects.
Okay.
And we'll see about other subjects coming up.
They're coming up, okay.
Yeah.
All right, that's going to do it for us this week. Thank you for tuning in. Dr. Stanley Himes, you're on the road to wellness. There's no better way to drive to wellness other than this man, Dr. Stanley Himes on CTV Beam. I'm Edgar Champagne. We'll see you next time.